Do you have knee pain that's not going away? Maybe you've had knee surgery and you've got pain from that. Maybe you're about ready to have knee surgery and you'd like to avoid doing that. Whatever the cause, whether you've already had surgery, whether you've already had a lot of work done, maybe you've seen multiple clinicians, what you're about ready to see here is different than anything you've seen, because we're not going to go to the painful leg to treat it. We're going to go to other parts of the body that move well, like the other leg, like the trunk, like the arms, to fix your knee. And you're going to see, and you're going to say, how in the world did this work so quickly, and why has nobody ever told me about it? All right? When you see this happen, all of a sudden it's going to look weird or backward. But once you get done and it works, you're going to wonder, oh my gosh, this should have been known a long time ago, because it would help you get rid of a lot more pain. So my job today is to make sure you know how to do it. So I'm going to give you the instructions so that you can do it on yourself. All right? Then I'm going to tell you, after we've done the treatment, what you can do from there, okay? And maybe why some of it works, okay? So I've got a cement block to represent my step. And what you're going to do is, many of you have knee pain going up and down steps. So what I'd like you to do is to test yourself. And again, you might need a higher step or a lower step, because I don't want you to have tremendous amount of pain, but I want you to go, oh yeah, okay, the right knee hurts and the left one's maybe easy. You're looking for one to be hard, yucky, maybe painful, maybe it feels restricted, and the other one to feel normalish. If they both hurt, this isn't going to be the exercise for you to change you. But you can at least test both sides, and you'll give it a score here in a minute. So you're just going to find which step up or step down bugs you. So I'm going to go forward, and maybe I'm going to go backward. This often really causes people a lot of pain. But slow your momentum down. All right, don't use a lot of momentum, and see which one's the hard one. You can even, maybe your pain's going off to the side and coming up like this. But you're going to test until you find a motion that hurts your knee. And if that doesn't hurt, maybe there's another motion you can do. But we call this the one-step quick fix, because 60% of you, just from this alone, will get pretty good, significant changes. Some of you, it'll be like, wow, that was the ticket. I'll explain that later, but let's just get right to the doingness of it.